Hi, I'm Dr. Tamer Issa, Doctor of Physical Therapy, and I'm here to talk to you about telehealth physical therapy. Basically, if you are stuck at home with aches and pains, if you are worried that you can't get help, if you're worried that your problems might get worse because you're not able to get the treatment that you need in the short term, um, I totally understand that your aches and pains and health problems don't necessarily go away just because you're unable to get out of your house, and that's what telehealth therapy can really be helpful with. Um, let me answer some common questions about it that most people have, and number one is, how does it work? Well, a telehealth physical therapy session is really not much different than a regular in-person physical therapy session, in the sense that we're going to ask you questions. I'm going to do complete an exam. I'm going to tell you what I think is going on and why you're having the problem that you're having. I'm going to give you options to solve that problem in the sense of recommendations, whether it be therapy sessions or possibly following up with another medical professional. I'm also going to instruct you how to take care of your problem on your own through exercises and education and posture and body mechanics and computer setups at home and things like that. So that's what that would look like. That's what we do in a regular in-person session as well. So there are a number of reasons why telehealth is really popular right now. For one, obviously, people are isolated to their home given the social distancing and and dealing with the coronavirus. So that's one reason. There are some people that can't get out of their home very easily because of functional or physical limitations and disabilities. So we're able to, telehealth can be an option for that. A lot of folks just like to do check-ins or follow-ups, after sessions. And this is a very easy format to be able to do that, where you don't have to come into the office just to have a 15-minute or a 30-minute kind of follow-up session. Another reason why it's popular is because, especially you live in our area in the Montgomery County, Maryland, or the DC metro area where traffic can be a bear. This makes it a lot more convenient, and so that you're not taking hours out of your day just to go to physical therapy. So that's another reason why it's pretty popular. And then for some people, they just would prefer to get treated in the comfort of their own home. So there are a lot of reasons why this might be a good option for people. So let me answer some common questions that people have around telehealth therapy. One is, first is, I kind of already answered it. How is an in-person session different than a virtual session? And really, it's not any different. And for the reasons that I told you, is that we're going to ask you questions. We're still going to take a history. We're still going to observe and assess how you move. We're going to ask you to point to where it hurts. I'm going to try to get to the root cause of your problem, and then give you recommendations for the best course of action, both in the short term and in the long term. So another common question that people have is, how does it work, telehealth physical therapy work, when you can't actually physically touch the person or touch where it hurts? Once through the history and the physical exam, the movements and tests, that's really where we get the bulk of our information, right? The pointing, I'll ask you to point where it hurts and ask you if it's tender and things like that. And that also gives me some information. After that, I'm going to run you through very specific self-treatment techniques, as well as exercises and specific movements that will actually not only improve your ability to move, but also lessen your pain. And I think that's it's very common for someone after a telehealth physical therapy session actually feel better and have less pain and to be able to move better. So in that sense, it's not very different. It's just that our techniques are going to be slightly different because I can't physically put my hands on you. So another common question is, I don't have a lot of workout equipment at home, so can I still use telehealth? Well, of course, absolutely. You don't need a lot of equipment to do this stuff. I mean, you'd be surprised what you can do with a ball, a stick, a stool, a chair, a mat. That's really all that we need. And if there is something that I think that somebody might need that would help their recovery or their therapy, I will definitely make that recommendation for you to get that. So, what technology do I need in order to have a telehealth physical therapy? Well, the beautiful thing about the system that I use is that you don't need a download, you don't need to set up an account, you just need a browser on a computer or a device like a tablet or a phone with a camera and a microphone. And we use a very easy and simple and easy to use platform called Doxy.me, where I literally will send you a link or send you an email. You click on that link. You are now in a virtual waiting room. I see that you're there, and then I start the session, and it's really as simple as that. So another common question, are the telehealth sessions private and secure? And I want to tell you absolutely yes, they are. All the data is encrypted. Your sessions are anonymous and none of your information is stored. We do not record your sessions. And Doxy.me, the program, the system that we use is geared towards medical professionals, so it's completely HIPAA compliant. So, the last question, will telehealth sessions be recorded? They will not be recorded. I will take notes and document into your electronic record just like I would any other session. So, my purpose is to help people to feel better, move better, and be better so that they can get back to doing what they love and daring to do what they dream of. That could all start today from the comfort of your own home with a telehealth physical therapy session. There's no need to take 2 hours out of your day and get ready and travel to see a specialist like myself. Virtual visits can give you the convenience and ease and comfort of getting some of the help that you might need for a problem in the comfort of your own home. So I hope that helps, and I hope that answers some of your questions about telehealth physical therapy, and I hope to see you online soon if the need should arise. So take care.